Well, happy Sunday, everybody. Good to see you right here on Health Diary. My name is Winnie Lubembe, and we're coming to you from Malaika. Now, listen to this. Preeclampsia is a condition that causes over 70,000 deaths annually. And this is across the globe as far as pregnant women are concerned. So the biggest question is, a condition that affects so many people and causes so many deaths, why is it not well understood? Well, you want to stick around until the end of the show to find out why and if there are preventable ways that we can employ to avoid preeclampsia. Well, all that is coming up after this fact of the matter. Preeclampsia is a high blood pressure disorder that typically develops after 20 weeks into pregnancy. According to the World Health Organization, preeclampsia affects 2 to 8% of pregnancies worldwide, with a turnaround of 46,000 maternal deaths due to preeclampsia per year and around 500,000 fetal or newborn deaths. If left untreated, preeclampsia can lead to serious complications for both mother and the baby. All right, let's tackle preeclampsia, a condition which, according to the WHO, affects 2 to 8% of pregnancies worldwide. So clearly, there is need for us to have this conversation. And to help us with the same, we have Dr. Marianne Monge, who's a consultant obstetrician. I have to say that word, obstetrician gynecologist here with us today. Dr. Thank you so much for your time. How are you doing today? We pulled you from a clinic. Thank you for making the time. And we also have Ashley Muteti, who's a passionate maternal health advocate and a preeclampsia survivor as well. Ashley, how are you?
I'm fine, thank you.
Thank you for sharing your story with us. We'll get to hear it in just a second. But Doc, can we start with preeclampsia? And we've had this term, but at the same time, we still have so many women, affected by the same. So what exactly is preeclampsia? Because there's preeclampsia, there's eclampsia, and there's...
Absolutely.
Okay, so can we start with preeclampsia, which is what we're focusing on today?
So preeclampsia is a condition that affects women in pregnancy, and it's usually seen at 20 weeks and above. And this presents as a high blood pressure reading, anything above 140 over 90, and also combined with protein in the urine.
All right.
This is something that we encounter frequently in a lot of women. And a lot of times you'll find that a woman will present with something as common as a headache without knowing that this is one of the symptoms of preeclampsia.
Preeclampsia.
Yes.
Okay. So you talked about 20 weeks. Why that specific mark, 20 weeks and above?
Hypertension can happen at any time in pregnancy and can be detected at any time in pregnancy. So you'll find that there are women who come at 6 weeks and their blood pressure is high.
Right.
So these are women we classify as chronic hypertension before 20 weeks because this is something they may have had before pregnancy and it's just being detected as early as any time before 20 weeks.
All right.
Past 20 weeks, you can still have high blood pressure without protein.
All right.
Which we call gestational hypertension. But if it comes with protein and it's going to a level of above 160 and diastolic of above 110, that is definitely preeclampsia.
Okay.
Yes.
All right. And then you talked about eclampsia as well.
Yes.
So what exactly does that mean?
Very good. So eclampsia is if a woman comes in with preeclampsia and then it goes and becomes severe and a woman has a convulsion. So a lot of times a convulsion will show that this is a woman who's had severe preeclampsia from a long time and maybe poorly controlled, and then it goes to eclampsia.
Okay.
I must say that preeclampsia is a progressive disease, and as much as we say that we are managing preeclampsia with antihypertensives, sometimes we'll give you some more medicine in pregnancy. It is a progressive condition, and the only treatment for it is delivery. So as much as you may see that blood pressure has been well controlled, it's within normal range, it might still go on and a patient has a convulsion with normal blood pressure.
Yes, and we do not want that.
We do not want that.
Okay. All right. Ashley, I saw you nodding to a lot of things that Dr. was saying, and I want to believe this is based on what you have experienced, so you can relate to some of the things that she is saying, right? So can we go back to the first, because you don't just have like a first experience, right?
Yes.
How many do you have?
3.
3.
Yes.
Wow. Okay. Let's go all the way back. What happened?
Yes. I got pregnant and, as every other woman, you're just very happy and excited about this pregnancy. But little did I know that I would experience such a challenging pregnancy. And a lot of women don't go into pregnancy anticipating that something can happen.
Yeah.
Everything you see is usually pregnancy bliss, looking nice, and,
photo shoots, every day holding the bum, Yeah.
But in my case, it was quite different because at around the same time, the way Doc has mentioned, around 24 weeks, I started feeling unwell.
All right.
And I started realizing that my hands, my feet, my face was swelling. I was having very bad headaches. And I remember going to a facility near where I used to stay. And they were like, we have to remove the baby. And I was like, I'm only 6 months.
What do you mean? Yeah.
Pregnant. No, it can't happen. So I decided, okay, let me go to the official, where I was supposed to deliver. And they admitted me for during that day. And I went home the next day.
All right.
But it was still not, I was still not okay. Yeah. So I went back to hospital again, and now I was admitted fully. And I stayed in hospital for a full month. They were monitoring me. I mean, the swelling was getting worse. I remember there's a day I gained 6 kgs in a week. I was so swollen. I couldn't even breathe properly, and the doctors were trying to contain my situation so that I can get to a viable period or gestation where I can give birth.
The baby, yeah.
But things got bad pretty fast, and my organs were being affected.
Oh, no.
Now, my liver, my kidney were now signaling things are not okay. And so the doctors agreed to actually deliver me at 30 weeks.
All right.
And I delivered 30 weeks. The baby was 1.2 kgs, very small. And that journey also was quite difficult because now you've delivered a very small baby. You're being told that I have to go to ICU.
Yes.
You've never been there. ICU has a lot of sick babies,
Yeah.
And it was quite challenging because my baby also experienced a lot of challenges, including hypertension. As small as she was, she also had edema, what I had with the swelling.
Yeah.
And these were complications that came as a result of her being born prematurely.
Okay.
So after 49 days of life, unfortunately, I lost my baby.
I'm sorry.
And we named her Zuri, and that's why I started a foundation, actually. In honor of her.
Yeah. Oh man, I'm sorry. I'm so sorry. And Doc, just speaking on what Ashley has said, so she's feeling unwell. The swelling, you mentioned headache a little bit. And most of the time, this is things that we might see and say, well, it's pregnancy. There's some people who say they've had headaches since they became pregnant until almost the last day of delivery. And then the swelling pads, especially with the nose, people say, the nose. So it's very easy to assume that this is just a normal pregnancy occurrence, but really isn't, right? So can we delve deeper into the symptoms and what we should really be cautious about that could be a sign of preeclampsia?
For preeclampsia, you'll find that a patient may come with a headache. So when a patient comes in with a headache, what we want to look at is how is their blood pressure.
Okay.
And once you combine a headache and sometimes with blood, vision and vomiting, sometimes those are signs of preeclampsia and with severe features.
Okay.
Then some patients will come with difficulty in breathing. As Ashley said, you find that when you start retaining fluid, some of this fluid may go to your lungs, and a patient may present with a bit of difficulty in breathing, some chest pain. So these are signs or the symptoms that will tell you that let's look at the blood pressure and see how it is.
All right.
Other patients may come in with pain below the ribs where the liver sits, on the right side especially, or in the center of the tummy. So this is a sign that also the liver could be swelling up and it's going through some changes that are indicative of preeclampsia and severe features.
Okay.
Some patients will come in and they have a reduced urine output. They're not passing urine as they were before. So they will have reduced urine output or no urine at all. And this is a sign that the kidneys have been affected.
All right.
In some cases, the patient will come in and they have very severe pain in their abdomen and that's in the tummy. And that's sometimes a sign that the placenta could have separated. And in some cases, this may come in with vaginal bleeding or bleeding coming from the vagina. They may also come with reduced fetal movements, feeling that the baby is not doing so well. So when a patient presents with any symptom of preeclampsia in pregnancy, we look at the patient as a whole, not just as a woman, but also given that they have a passenger on board, we want to see how is the baby also doing. And depending on the age of the pregnancy, the approach of care is tailored, depending, it changes, varies from patient to patient. There's no one treatment that fits all. But for these patients, a lot of times we'll start them on antihypertensive. Depending on their age, we will try to give medicine to mature the baby's lungs in case we are foreseeing a delivery will happen soon. And we might also give some additional medicine to prevent a convulsion from happening.
All right.
We've mentioned that the symptoms the patient will come with, but there are also other things that other people will observe. For example, if a woman collapses and maybe they're having a fit, that's a sign that the patient has already gone to eclampsia. And the management for eclampsia is deliver the baby, regardless of the gestational age, get the baby out.
Okay. All right. So Ashley, a tough time, and you stayed in hospital. How long? Released, and then at what point did you decide to, well, maybe we can try again?
I actually wasn't planning on trying again after the loss of my child. And I think the first thing I did after the 6-week mark, I told my doctor I want to get on a very strong contraceptive for the next 10 years.
Okay.
So I've actually conceived 2 of my babies on IUD.
Okay.
Yes.
Okay.
So I conceived my second baby when I had contraception. Yes.
Interesting. Sometimes people are like, okay, how exactly does that happen? Like the baby's like, and this is going to happen. All right. And still head fit on as far as preeclampsia is concerned with the second baby as well?
Yes. So for the second baby, I had preeclampsia, but now I was a bit more informed about my symptoms, what I should look out for, the tests that I need to do. So I started my clinics immediately. I found out. And the doctors gave me 2 options. One, to terminate on medical grounds, or to continue as a high-risk patient. And I had already buried my child. I just felt, okay, let's see where this goes. And so I carried on with the pregnancy until around 26 weeks. Also, I started feeling really bad, but I was keenly monitored. But one day at 31 weeks, at 30 weeks, actually, I did a scan and it showed the baby had stopped growing. So the doctor said I was 30 weeks, but my baby was 26 weeks, actually.
Okay.
And so they had to deliver. They had to deliver me.
Okay.
At the 31 week, I started bleeding. The same thing Doc is mentioning.
Saying.
It was actually pretty fatal because I had to be rushed to hospital immediately and get the cesarean done.
All right.
Immediately.
Doc, very briefly, just to pick on what she's talked about, and then we go on a break.
So, what you've mentioned, you've had preeclampsia before. And now this is the second time it's happening. So, the risk factors for preeclampsia, having had a history of preeclampsia is one of the risk factors. It's a major risk factor. And for women who come in with chronic hypertension, they are also at a risk of having preeclampsia.
Okay.
If someone has had IVF done, if there are other comorbidities, something like diabetes, renal disease or kidney disease, or if they have autoimmune disease. For example, if someone has had lupus or they're having antiphospholipid syndrome, these are things that increase the risk of having preeclampsia. Other things that can increase that risk is the age of the woman. So a very young woman having a pregnancy, the first pregnancy, or a woman at the age of 40 and above having a pregnancy, that's a risk. There's a global pandemic of obesity. So that's also another risk. And that's why we usually try to tell women optimize the weight before conceiving. It's just to reduce some of these risks. Other risks are things like a long interpregnancy interval. If someone has stayed about 10 years before getting a second baby, that's also a risk for preeclampsia. And these are things that we discuss in the clinic when we look at a patient when they sit in front of us. These are some of the things that we ask.
Okay.
And they just go into the history, risk profiling, and then we say how better to reduce the risk of these complications in pregnancy.
I see. Yeah. And then you talked about preeclampsia being a progressive condition. So when we come back from the break, then we'd want to pick up from there. And then based on your experience, because we'll look at the third one, and then the foundation a little bit. And then what is it that you want women to know as far as preeclampsia is concerned? Because sometimes we don't want to talk about these conditions because if you talk about it, it might come. So we avoid these conversations, and yet it's important to have them, all right? So all that is coming up after the break. Just stay with us. Welcome back. Glad you're still with us. The show is Health Diary, and today we're focusing on preeclampsia, and which we said when we started the conversation affects 2 to 8% of pregnancies, and this is across the globe. So we have Dr. Marianne Mwangi, who's a consultant obstetrician gynecologist, and we also have Ashley Muteti, who's very passionate about maternal health, and is also a preeclampsia survivor, also to share her story with us. So before we went on a break, we were touching on so many factors that you need to consider, okay, and especially as far as the risks for preeclampsia are concerned. And so now we want to pick up on the progressive part. But before that, so Ashley, so baby was delivered at 31 weeks, you said?
Yes, 31 weeks, weighing 975 grams. She was not even a kg.
No.
Yeah, she was very, very small.
Okay.
Yeah.
So how was she doing? How long did you stay in hospital? And even just the post-pregnancy?
The baby came out, actually, I met the doctor one of the doctors who delivered me, and she said when they were operating me, they found a pool of blood because of now how I was bleeding.
Yeah.
And the baby had flatlined, so they had to resuscitate the child.
Yeah.
So we stayed in hospital for a period of 3 months. Because she was very small. And then she also had a few challenges. We had a few blood transfusions here and there. But right now she's doing very well.
Yeah.
She has hit all her milestones.
How old is she now?
She's 6.
Oh, okay.
Yes.
All right.
She's called Amani.
Okay.
And she's just a ball of energy.
Yeah.
Yeah.
Okay. Third baby?
That baby was pretty smooth because I started getting hypertension at around 32 weeks.
Okay.
Yeah, so this was pretty advanced. However, I was on medication throughout. And one of the things I think, which is going to be Dr. can talk about, is the management of preeclampsia is very, very important. So I got preeclampsia at 32 weeks. And really elevated BPs and also the swelling, and delivered the baby at 35 weeks.
Okay.
So we stayed in hospital for a period of 3 days. This was my first ever experience not staying with a baby in hospital. And it was pretty nice. But even during the cesarean section, it was pretty challenging because my BPs were very, very high. We were hitting 200. Yeah. So it was very, very high.
Yeah.
There's a point I was losing a lot of blood also. So it was a bit challenging during the delivery. But I'm glad the outcome was good. Yeah.
Okay. So how's your baby now?
She's 3.
Oh, 3.
Yes.
Okay.
Yes.
Okay. And say for someone who has hypertension as a pre-existing condition and they want to get pregnant, I know there's a bit of that scare. Will it not? What's going to happen? Are there things that you might advise this person before even considering getting pregnant?
So before getting pregnant for a hypertensive patient, what we'll see is how do we optimize your medication?
Okay.
There are antihypertensives that are safe in pregnancy. There are those that are not safe in pregnancy. So before conceiving, we want to see what medication are you on? Do we need to change it to something different? And then also after that, now, once you conceive, just follow up with your clinician.
Okay. All right. And Ashley, so your foundation, what is it that you say picked from the conversations that you've had, or what is it that you'd want women to know about preeclampsia and the whole idea about, well, it's pregnancy, headache here, swelling here and there, and maybe could be a sign of something serious. So what is it that you want women to know? But the things that you've picked, first of all.
One, there's truly lack of awareness about this condition. People are not talking about it And it is the second leading cause of maternal death. So it is very, very serious for every pregnant woman to know. In fact, it can even happen to a first-time mom. I did not have any pre-existing condition. I did not have anything. But the fact that I was a first-time mom also is one of the risk factors. So one of the things that we see a lot is women do not know about the condition. Number two, preeclampsia presents itself more like pregnancy symptoms, like you will swell here and there, you'll feel a bit of headache, you'll feel like vomiting, you'll feel a bit nausea. So at times women don't know how to distinguish between I am in danger and this is a severe condition that I am going through. The other issue is also in terms of intervention, really, because probably there's a woman who has stayed with this condition. You go to hospital late when really no intervention can be done, or maybe delayed intervention also. So these are some of the things that we're actually experiencing women to know. And I'd encourage women about preconception care. That's one thing we really like talking about because we are used to, let's get pregnant, without that care. And I encourage women to actually go to a doctor first and see, are there risks that can hinder, or are there any issues that can hinder a successful pregnancy through something like preconception care?
I see. I mean, it's usually advised before you even think about getting pregnant, just go to a hospital, do what's happening, and then some might do that, some might not. Others actually realize they're pregnant 3 months in, right? And others, can go for the visits, which is important, but then again, skip for a while until the baby's almost here is when they go back to a hospital. Can we talk about how risky that is? And also, as we close, what conversations would you want to say we had in the next 2 or 3 years? Are there other interventions that maybe researchers are delving into just to see how much we can prevent cases of preeclampsia? Yes.
So in terms of preconception care, it's very important. A lot of us are still finding it to be a new concept, especially for someone who's trying to get pregnant. They're like, let's get pregnant, then you'll go to the clinic at 20 weeks off to some time.
Doctor, yes.
Especially when someone says I've carried a pregnancy before. And
not my first rodeo.
You'll find that there's a lot that will be discussed in a preconception care visit. There's a lot that can be picked. In this visit, you can pick something as simple as an abnormal blood pressure. You can pick an abnormal blood sugar. And you can also pick other things that will point to a higher risk pregnancy. And there are times you're going for a preconception visit and the doctor will say, pause, let's optimize this before you conceive, just to reduce your risk in pregnancy. And that is solid advice because in case now you're in a position where you can alter some things, go ahead and alter them before getting pregnancy. Get it pregnant because this is something that will change your follow-up, your planned delivery, and also just your outcome sometimes.
All right.
In terms of your first antenatal visit, we say try going as early as possible. Ideally, have a visit before 12 weeks. That's when we do our antenatal profile. We do a scan for the baby just to see where they're sitting and also look at certain things which are soft markers for other abnormalities for the baby. After that, we see you tailored depending on the patient again. But we do a visit before 12 weeks. We try put in another one at 20 weeks or so. Between 24 to 28 weeks, we screen for diabetes in pregnancy. At 32 weeks, we check your blood level. Then at 36 weeks, we plan for delivery and we do something called a growth scan just to assess how the baby is growing.
All right.
This can be altered depending on the patient sitting in front of you. We can plan for an earlier growth scan. We can plan for an earlier test to check your blood level and such things. In terms of delivery, when it comes to preeclampsia, again, tailored to the patient.
To the individual.
The mother definitely takes priority. So if you find that someone has severe preeclampsia and we are at a risk of either compromising the brain, the heart, the kidneys, the liver for the mom, baby is delivered. If you come in at 34 weeks and above and everything is stable, you can see, do we push this to 37 weeks and get the baby out of 37 weeks? Or is it too risky for the mom or for the baby and you get the baby out of that point?
I see.
So that's definitely tailored depending on how the patient is sitting, sitting in front of you. In terms of research for prevention of preeclampsia, there's a lot of research and there have been publications by different groups. And I'll not mention the names of what they're using, but there is definitely research for medicine to reduce the risk of preeclampsia.
Okay.
And this is medicine that's given as early as 12 weeks or even earlier, sometimes for a month or so, and then we stop it, then we continue with aspirin until 5 to 6 weeks.
Okay. I see. I mean, it's a good thing that there is hope. And that's a positive way to end the conversation today. Dr. Marianne Mwangi, who's a consultant obstetrician gynecologist right here at Malaika, and Ashley Muteti, who's very passionate about maternal health, and she's also an advocate, but a preeclampsia survivor as well. Thank you so much, ladies, for your time today. We've learned a lot, and we hope we can continue these conversations over and over in our WhatsApp groups, in our chamas, all those things. Let's talk about preeclampsia. Well, with that, we conclude today's episode of Health Diary, where the takeaway is a headache here, swelling there. Well, instead of assuming, how about you get yourself to a hospital? And this is for the pregnant women, because it could be a symptom of preeclampsia, which could be fatal if not, well, attended to immediately. If you have any other question, our social media handles are down at the bottom of your screen. My name is Winnie Lubembe, and a special thanks to Malaika for hosting us today. Until next time. Adios.